so excited to demystify a much misunderstood topic that we get questions about all the time, and that many women have been misled about by their very well-meaning physicians. Yes. This is something that we get all the time. Women are being told that by their doctors that pelvic floor dysfunction and pelvic organ prolapse are not painful conditions and that they don't hurt. And I know for a fact that that's not true because I live with some of that, and I'm pretty sure Jen knows it's not true. But more than anecdotally, we know that's not true because for a living we work with women suffering with these conditions. And we're going to talk a little bit more about, okay, well, my doctor told me this, why, we believe our doctors, and our doctors know a large amount, but very often what I find is that I think that when they say these things, they're thinking of things from a very
specialized perspective.
Specialized perspective, exactly. Maybe a narrow viewing window. And what we're able to do as women who live with these conditions and women who treat other women, successfully treat other women who live with these conditions, is bring that viewfinder back a little bit and think about what's actually happening in the body when you have these conditions, and why it makes complete sense that this stuff hurts.
Yeah.
It's not only is it real pain, it's real pressure, and all of those symptoms result in massive amounts of emotional pain. So let's not forget that piece too, but we can start with the physical pain.
Yes. We talked last week, we shared some images of what pelvic organ prolapse is, and pelvic floor dysfunction, just to be super clear about what we're talking about here, is just the muscles of the pelvic bowl that literally hold your guts up.
So here is our favorite image from my anatomy textbook from physical therapy school that really shows where the bones of the hips and pelvis are inside the body. I love the way that's drawn. It takes the guesswork out and it makes it not so medical. So the pelvic floor, do you want to kind of point to the picture?
Yeah, it's just the sling of musculature underneath here. So it's literally a bowl of musculature that holds your guts in.
Yep.
And pelvic floor dysfunction means that those muscles aren't firing to support you in all of your daily activities, essentially. And so you get weakness, which then the body is forced to call on other muscles like hip rotators, back extensors.
Hello piriformis syndrome, hello SI joint dysfunction. Yep. If you've heard any of those terms.
Sciatic pain.
Hello sciatic pain.
Yep.
So yeah, the things that sit inside this bowl are your pelvic organs.
Yep, which are these guys. Not to scare you, but it's these guys. This is the side view. But all of that is nestled up into your pelvis. So naturally, these things also have some ligamentous attachments that hold them up.
Because they sit in here, in that bowl. These organs are sitting, and when you're walking, they're doing this on your pelvic floor. And when you, goodness knows if you jump, that's a lot of pressure down on that pelvic floor that's supposed to be holding all this stuff up and in. Or if you bend over, it presses things out a certain way. Or if you lift something heavy, it's straining, and you get that downward pressure. These organs are trying to press down through the pelvic floor. And the more weakness you have through there, or the more birth injuries you may have had, the more the weight of this stuff inside that bowl of the pelvis is pushing and pulling and causing pressure.
Pulling, tailbone pain, low back pain, all of those things. And maybe you're watching this video going, you know what? I didn't have kids, but I had an abdominal surgery.
Ooh, yes, or a major back injury.
Or a major back injury where I know I blew out L5S1, which is a popular spot of weakness.
Yep.
And then I started having these symptoms. We're talking to you too. You don't necessarily have to be dealing with this from childbirth. You don't have to be a mom to be dealing with these things.
Very often childbirth is kind of the initial injury, let's just say, because in this country we're not escorted through any sort of rehabilitative process, as a matter of course, after the inordinate strain of full-term pregnancy and childbirth on this part of our body. Nobody takes care of it afterwards. All we want to know is how's the baby, and that's important too. But what about mama? And sometimes that's the initial injury. Maybe you didn't have symptoms at first after you had your kids, or maybe you were so focused on keeping your precious baby okay that you couldn't even afford to listen to what was happening here.
Correct.
So sometimes maybe you think, I don't know, I had my kids all these years ago, how could that have anything to do with it? Very often that was the first kind of break in the link of the chain of the continuity and the connectivity with and in and about all the muscle tissue that's designed to hold all this up and in and support your back and your hips.
And it's the compound effect.
Yep, exactly.
It's the compound effect of these muscles not firing and turning on for your simple task. We're talking about sitting and standing. We're talking about walking. We're talking about picking up kids. We're talking about some very simple basic tasks that you might be taking for granted. But those muscles, if we're not rehabilitated, continue to get weaker. So the other muscles have to pick
Work
up
harder.
the load.
Hello, piriformis syndrome and sciatica. Yep.
Hello, foot and plantar fasciitis.
Yep.
Hello, knee pain.
Yep.
IT band syndrome. All these things related and coming back to the pelvis. Hello, bunions on the feet.
We have seen massive changes and improvements through the program that we teach you in Tighten Your Tinkler, the Women's Pelvic Recovery Program. We've seen incredible changes for women in knee symptoms, bunions starting to realign and correct themselves. So yeah, does this hurt? You better believe it. And are the repercussions of these conditions far-reaching in types of pain, types of pressure? And hello, we haven't even really dove into the bowel and bladder symptoms, which are they pain? I don't know. Not emptying your bladder and bowel regularly, to me, can result in a whole heck of a lot of pain. Recurrent UTIs, constipation, all of this
straining and feeling like
hemorrhoids.
Yes.
This can all be related to dysfunction through the pelvic floor and or the progressed version of that, which is the pelvic organ prolapse, those organs actually pushing down and a little bit out through that bowl of the pelvis. So,
and we're not dismissing any of those other diagnoses or, conditions. We're telling you that if you only focus on that, you're missing the boat on getting to the root of the problem. Actually being able to overcome and continue to do the things that you enjoy versus constantly having to regress. Clients coming in saying, I can't squat anymore, I can't lunge anymore, very, very limited. They just keep narrowing the box that they live in and limiting what they can do.
And I'm telling you, that is why we are so excited about finding the tool that we found and that we use and teach you how to use, along with the let's see.
The recovery.
Yeah. We teach you an amazing conglomeration of tools that all come from our years of experience working with women, rehabilitating them from the core, and that is getting to the root of so many symptoms.
And these are simple lifestyle changes. We get that it sounds too good to be true, and look, I'm a skeptic. If I'm looking at something and you're telling me in 10 minutes I'm going to change my life, I'm rolling my eyeballs at you going, yeah, right.
Yep.
But this is the truth. It's the collaboration of the recovery tools with, once you learn the exercise sequence that we teach you, which is not exercise, I'm going to sweat, this is going to be hard, I need a lot of space. Not talking about that. Very simple routine that you can do in the beginning of your day that's going to activate and turn on all the things that we just talked about to be able to support you through the day, so that you stop having as much pain and you start increasing the ability of your body to function. As a biomechanics junkie, it's the stuff that I live for. It is the body truly, just from a mechanical perspective, being able to function better because all the parts are working. All the right stuff, all the spark plugs are plugged in the right spots, and everything is working. The rewiring project that we talk about in the activation series of this exercise program is just a game changer. It's small, but it's super impactful.
It's a massive power punch of function back into your life. and into your emotional fortitude to know that you're going to be okay and you have the tools to manage your symptoms. And it is a vast array of symptoms, from pressure and pain and bowel and bladder issues to intimacy issues that affect your marriage and your life and your ability to relate to and be with the people that you love the most in such a broad number of ways. So we've got a list of all those symptoms on our website, tightenyourtinkler.com. We've got a quiz you can take if you're wondering if you're the right fit, or if any of this applies to you, if you could benefit from this program. We've simplified that all for you.
But imagine what it would be like. We're headed into the holiday season. It's a time where we want to spend time with family and friends. We're out doing really fun stuff depending on where you live. I know when we travel up north, this is the time we like to ice skate, which I would have never been able to do a couple of years ago. We like to hike and go for walks. We like to be active. We like to shop. I like to shop and carry heavy bags without my back hurting. All of those things that you could, just the simple things, getting on the floor, playing with kids, grandkids, being able to enjoy that, not being in pain. That is a real thing that could happen for you.
Or not having to worry about wetting your pants or leaking on someone's freshly Scotch guarded sofa. So
and not having to pack 20 pairs of underwear for a 5-day trip. You know,
we got you, ladies. Like, we are so excited to get this program out there. And yes, pelvic floor dysfunction and pelvic organ prolapse hurts in so many ways, and we are ready to bring you the relief that you deserve, and it doesn't have to be hard.
It really doesn't.
Please shoot us any questions you have. We want all the hard questions. We're ready. We do this every day here in the clinic, in the studio, and we're ready to help you too through the magical power of the internet.
So if you're not comfortable with putting your comments below, please feel free to DM us with your specific situation. And please go and take the quiz. You'll learn a lot about the things that we can help with our program just by taking the quiz, and that's at tightenyourtinkler.com.